All right. I'm going to pause the recording for a second. There we go. All righty. So we'll go ahead and just get started with our introductions because we respect people's time and we are recording this. So for those who weren't able to attend live action, of course, you may come back and see it anytime. We have a fantastic YouTube channel, which I'll send out in our LinkedIn post. And it is a pleasure to be here. My name is Leah Sigler. I'm a dental hygienist. I'm a mom and I'm the president of the TeleDentistry.
And I am Maria Kunstadter. I'm a grandmother, a mother, and a dentist, and the CEO currently. I got promoted of the TeleDentist, and I don't have much of a voice, so I won't be doing most of the talking today.
Which is fine because Lord knows I can talk to a brick wall, so that's good. But we did prepare a fun slideshow for everybody who's able to watch us, and be careful while watching. And we will go ahead and get started. Celebrating National Children's Dental Health Month, which should be every month, as we know. But you know, being parents, being educators, being dental, and of course being the teledentist, we wanted to put together this presentation on pediatrics in teledentistry. We're going to talk about some use cases. We're going to talk about where we see teledentistry currently being used with the teledentists, and where we would love to knock down and kick down doors so that teledentistry can be utilized more to help kids and their parents and caregivers. So hooray, we made it. February is one of my favorite months, National Children's Dental Health Month. And of course, not shamelessly promoting the teledentist and getting quality care when you need it. So every February we celebrate and we learn and we grow together so that we can take our lessons and continue to develop and have happy, healthy children's smiles for life.
And coordinated with one of the highest candy giving holidays.
Right.
So I mean, it's a good one to coordinate with children's dental health.
For sure, for sure. And next month is even more with the Easter, right? But if you don't follow us or have you not subscribed to our newsletter, there's some interesting facts about yesterday for Valentine's Day, including the fact that dark chocolate is actually good for your teeth. So if you feel the need to share sweets with your loved ones, dark chocolate is obviously very favorable. And follow us on our newsletter email for more fun tips. All right, so let's talk about oral health in kids. And we do obviously focus in the United States. These are all statistics that are unfortunate. They're real. They mostly come from the CDC and from other, the ADA and other large organizations. But basically 52% of kids have cavities in their baby teeth, and an even higher incident in adolescents have cavities in their permanent teeth, with 46% of them have untreated cavities that need restorations in either primary or permanent teeth. We know the risk factors can include poor diet and inadequate oral hygiene care. And a lot of people, unfortunately, don't realize or acknowledge that you need to take care of the primary teeth in order to have healthy, happy, permanent teeth. So in the first 2 years, that's what really can put your child or a child at risk for life of cavities.
I know people are always surprised that you're supposed to brush a child's teeth twice a day. I mean, I'm always, even highly educated people, and it's like, well, how many times a day do you brush your teeth? Twice a day. Well, how many times a day do they eat and drink just like you? And yes, we do need to brush children's teeth twice a day. And of course, I've been a dentist for a long time. The biggest thing, well, they just hate having their teeth brushed. So we have behavioral skills to train parents on how to introduce and train their children on brushing teeth and how to help their children brush teeth. It's extremely important, a huge factor, and very underutilized in terms of childcare.
And honestly, even starting in OBG offices and in prenatal, getting the parent educated on what to do so that when that baby is born, having a healthy life for their life, a healthy mouth for their life, there we go, is one of the things we're going to touch on here. Race and ethnicity, we know, unfortunately, children from low-income families are twice as likely to have untreated cavities and therefore are at higher risk. And in the United States alone, acute unplanned dental care accounts for 34 million school hours lost. Now that's school, not just work, which we'll get to as well, where the parent has to take off middle of the night, going to the emergency room, waiting to the last minute till it hurts, and then taking the whole family into the ER, the urgent care for the kids' untreated dental cavities.
And one of the things I love to point out the most, being a public health advocate, is yes, public health initiatives can make a difference, because Cuba has the best public health program in the world. Public health learning institutions highlight Cuba's success in public health, and there's many factors for that. We don't think of little Cuba as being a country that we should emulate, but it is a communist country and people don't have a choice. They have to get their 3 times a year fluoride rinse, and it's not an option. Here we have too many options, and they are very good about instructing and focusing on prevention, because as we know, healthcare professionals, prevention costs 4 pennies on the dollar of what treating anything costs down the road. And in Cuba, if they do get a cavity, they don't have the materials or the tools to fix it. So they're very, very good public health programs, and they have a lower decayed, missing, and filled score on children entering kindergarten than we do in the United States. So it does, public health initiatives can work. It's been demonstrated to work in countries like Cuba and all over the world, and we need to make an impact here and globally.
Love it. There you go. So the biggest factor contributing to kids' oral health are the parents or the caregivers. They are the role models. So if they don't brush their teeth twice a day, or mandate that the children brush their teeth twice a day, it's not going to happen. Plus, kids are not born with bacteria in their mouths that cause cavities or oral disease. That is shared, and that was also on our newsletter. I used to tell my teenage patients as I was cleaning their teeth, hey, kissing is you're swapping spit. What do you think's in that spit? It's a communicable disease. So please make sure your partner or your loved one has clean teeth before you go swapping spit. That was not a fun one in the newsletter, but it is shown that if a parent or a guardian has good oral hygiene practices, that kid will pick those up and thus continue on and having a healthy smile for the rest of their life. Plus, how do you not smile when you see this? So cute. So the first step we know to remediating these tragic factors are improving kids' oral health at home. Many people, in fact, I'm a part of a mom's page local here in Kansas City. Go Chiefs. And so many parents don't even know when they're supposed to go see a dentist for their first time. And it is, the rule of thumb is 6 months after the first tooth is erupted, which is around 6 months. So the kid turns 1, you make a dental appointment. Now, of course, unless your kid is just fantastic and amazing and all that, which they are, we know, there's not going to be a lot done in that first visit. So we always encourage the parent to bring their kid with them during the dental visit, so they could see their parent, again, being the role model, seeing that it's a fun process. You leave squeaky clean. The tools are not as terrifying as you think, and not using words like terrifying in front of your kid is a good factor too. But they need to start seeing a dentist every 6 months, starting at age 1, to start prevention matters.
And my advice to parents is, if they call an office and they say, well, they're too young to bring in, call another office. Because that dentist is not up to date with even the recommendations from the ADA. In
fact, when I took my now 3-year-old to his first appointment, the dentist told me I only had to come back once a year for him. So I changed offices. I switched, because that's not correct. You go every 6 months and you make sure you fight for your kids. You get them the correct care that they need and deserve. Plus, you brush their teeth 2 times a day. Just like Dr. K said, you brush your teeth 2 times a day. Kids need to do the same. I had a pediatrician patient one time, and she was talking about how much fun it is to brush her kids' teeth. I was like, well, good for you. She goes, yeah, I just have to headlock them and then get the toothbrush in there for as much as possible. So you know what, if a pediatrician is telling you that she's doing that, it's okay. You're gonna have to headlock every once in a while.
And what I tell parents tell me all the time, well, they don't like getting their teeth brushed. I said, well, now if they had medicine and they were supposed to take 3 times a day, would you say, oh, you don't want to take it now? It's okay, you don't have to. You'd say, no, we have to do this. So parenting is one of the hardest jobs you'll ever have, but for, you know, for anybody with parents, you know what's right and that's why you're the parent. So
Absolutely.
don't take no for an answer.
Yes. Use fluoride toothpaste. We're dental professionals. We're going to push fluoride. We're going to push preventative care. You can do your studies on fluoride and you can come up with the same results as us. It prevents cavities. So please look into it and use it. Thumb suckers and pacifiers really should be on the same level because they cause just as much harm to the dentition.
Yeah, but you can't cut the thumb.
Ooh,
You
good
can
call.
only
Please don't.
trim back a pacifier. Don't try and trim back any thumbs.
And we get a lot of patients, man, so many parents pinging through on the TeleDentist platform. Oh my gosh, what is this bubble? What is this? What's happening? They're crying a lot. They're pulling on their ears and it's a tooth erupting. So learning the eruption sequence, even as a hygienist, I had to go back and, oh, is this tooth supposed to come out yet? So it's very important to know the milestones. There you go. You know the milestones of when your kid's supposed to walk, when they're supposed to say mama first. You should also learn when the teeth are going to erupt so that you don't freak out and panic rushing to the emergency room or happy to connect with the teledentist to teach you. But if you do have questions as a parent or as a guardian or as an educator, ask the teledentist or ask your dentist if you are lucky enough to have a dental office. So again, solutions. TeleDentistry. This is actually a picture of my dad and my daughter, and he's working and she's assisting. So I thought that was super cute to share. But TeleDentistry is a valuable tool for pediatric patients because it provides remote dental care for kids and for their caregivers. There's lots of different ways that teledentistry could be used for kids, and we're about to dive into that as well. But yes, Vita's been our I want to say
Guinea pig.
Go
ahead and say it.
Sure, okay.
Go ahead and say it.
She likes to tell all the kids in her kindergarten class that her mom works for the tooth fairy, which we'll talk about that in a minute too. So step 1 or option 1, if you will, remote consultations. That's about as basic and easy as it can get. What's this, what's happening to this poor kid's tooth? What's happening? Is she in pain or he in pain? But teledentistry allows pediatric dentists and GPs and dental hygienists to conduct virtual consultations with parents and the caregivers.
And research shows, if you need a copy of the research, let me know, that teledental screenings are as effective as in-office screenings on this age group of children. So being able to see them virtually or in person has the same effect.
Absolutely.
And I constantly, is this tooth supposed to be loose? And again, you guys have pediatric patients and parents just don't know. So why would they take off time from work, take the child out of school and run them to the dentist's office if they could simply do teledental consult right before bedtime and say, is this tooth supposed to be loose? Yes, it actually is one. Oh, okay. So don't worry about it.
Yep.
Easily solved in a very, very short time.
But teledentistry, you can talk about oral hygiene practices, products, diet. So, not just eating crackers right before dinner. In fact, banana is the newest one you're supposed to eat before bedtime. Love it. I'll send you that
Oh,
research.
please do.
Teething issues, those poor parents who are dealing with the kid in the middle of the night that just won't go to sleep because that tooth is not comfortable. How many times do you tell your adult patients that complain about their wisdom teeth coming through? Imagine how it feels to be a kid having all those teeth coming through and you don't have a way to communicate. But it's another way for parents and guardians to be able to express their concern about their oral health, their child's oral health. Now, I recently went to a school here locally in Kansas to do children's screenings, dental screenings. And I turned to the nurse and I said, we could have done all this through teledentistry. And she's like, what? I didn't know that. So teledentists are now pursuing, not now, we have been, school screenings where a nurse can simply show the kid's tooth, their kid's smile through our secure platform, and we can fill out the form. I mean, it's 1, 2, 3, 1, 2, 3. That's all the numbers that you need to do for dental school screening. And it's all easily and safely conducted through teledentistry because I get emails weekly volunteers needed, volunteers needed, because there's not enough dental hygienists to go into schools, let alone in dental practices. That's a whole other subject, to do these screenings, when a dental hygienist like myself or my friend who went with me could easily be sitting at home in our pajamas instead of our scrubs, same thing, and be able to do school screenings with the nurses.
And we have the capacity in those cases, if there's something that parents need to be alerted to, they could be called in on a three-way conversation.
Yeah.
And we also, this is something good for those that have private practices. This is a great patient generator, because being able to put them in your, say this child needs to see a dentist.
Yes.
And in that area, that vicinity, have your office accepting new patients from the teledentist would be a great, thing to promote, to have screenings done by the teledentist.
Yep.
And you on our referral list to have children go to your office when needed.
Perfect example. One of the kids that we were screening had severe decay, and you could tell he was in pain. You could tell he was uncomfortable. So being able to have a dentist electronically send in a prescription for the parent to pick up on their way to pick him up from school, and then get him to a dental office for actual treatment. That's the best use case of school screenings utilizing teledentistry. Absolutely. Emergency triage. Now that is our bread and butter, right? Anybody who is on their way to the emergency room is about to, go spend thousands of dollars for a toothache, can connect with the teledentist instead. So, oh gosh, how many pediatrics we get a day from a dental injury? Again, oh no, there's a bubble and it's a tooth erupting, but still, instead of taking that poor traumatized injured child to an emergency room or calling your dental office and they're like, we can't get you in until next week, you can have a face-to-face virtual conversation with a dentist and take that kid off the ledge. Now, one of my favorite, Dr. Jerry Strauss, in fact, he's on our YouTube channel, our interview. He was doing a rotation in an emergency room as part of his schooling, and he was called in for a pediatric case where the kid had lost a tooth had come out. By the time he got there, the ER doc had already placed the tooth. And he goes, well, doc, good job, except you did put it in backwards. So the ER doc had put the tooth in the wrong way. And all of that, again, could have easily been fixed or at least guided. He did that in a separate incident where he actually helped a mom temporarily replace that tooth back in the socket until they could make it the next morning to the dental office. But perfect emergency triage situation. And teledentists can also be triaged or used to assess the severity of the situation, because it's very rare that a kid will need to go into the emergency room. Fortunately, there's lots of situations where it's like, well, that tooth was loose anyways, you're going to be okay. You don't actually need a dental in-care or in-person visit. But when it is, we can say, you don't have to go tonight. You can wait until the morning and get a little more guidance on that.
And ED is not erectile dysfunction, it is emergency department.
But we do that too.
And I love it when I have a large group of men on my on our webinars telling that ED is correlated with poor oral health, and they all start squirming.
That's our next webinar.
They start squirming and look for floss to start using. But anyway, yeah, in emergency departments, sadly true in the United States, again, 69% of ED visits for pediatrics and emergent are paid by Medicaid. And these are children that just don't have access to get to a dentist from home. They could at school perhaps get some care, but as a last resort, because they have waited too long, they end up in the emergency department and have to be seen for the cost and expense of an emergency room and get no treatments rendered, no care is given, maybe an antibiotic, and then again, go find a dentist. And in most states, Medicaid, that's a big challenge.
Big challenge. Education and prevention. I love this picture. So cute. Teledentistry platforms can be used to offer educational resources, such as a telehygienist, who also can give preventative guidance to parents and their kids, including proper toothbrushing techniques and flossing. Yes, kids need to floss. Products, again, like fluoride, which toothpaste to use, dietary recommendations. My favorite was the crackers story. The kid just had an obsession with crackers. I said, throw some peanut butter on there, throw some cheese on there, something to break up that carb so it doesn't just convert straight to sugar and sitting there on the kid's teeth. So the goal, again, is to maintain optimal oral health for children and prevention. I love that.
And as we, the collective group here, and I believe our collective audience know, oral disease is almost 100% preventable. It is a bacterial disease. And again, the goal should be simple. And we're going to talk about the World Health Organization's goal as well, but the goal should be simple. Prevention is the key. And again, we work together on this. We can make things happen, just as they did in Cuba.
Right.
Excuse the squeak.
That was cute. So I love this one, behavioral management. Now, nobody's born with white coat phobia. It's somehow acquired and learned. So TeleDentistry can help break that barrier. That's not just for kids, that's for adults. We do that all the time, actually. So any patient that has dental anxiety or issues within the dental office can connect with the teledentist. They've actually said it's been proven in behavioral health to have patients open up more and be able to communicate more and learn more for their mental health, because that barrier is there and they don't feel as insecure. They're able to actually express themselves more. And we see that a lot in the teledentist, sometimes a bit too much, but it is a fantastic way for those with the white coat phobia to be able to actually talk to a dental provider and not have that just cold sweats and worrying that happens, unfortunately, to a lot of people.
I mean, kids and people always ask, can seniors use this? I said, well, I happen to run the company, so yes, seniors can do this, but children are used to talking to their friends and family on FaceTime all the time. So it's no different for the child in terms of an experience. I did see one survey recently that over 60% of the world's population say they're afraid to go to the dentist. And we do have a lot of phobics that come into our website.
I get that. Like, I hate being here, and you still have to be like, I loved seeing you. Thanks for coming in. That's great. But we work with the National Minority Health Association, and one of the webinar topics we were building together actually talked about what happens in a dental office. So again, I went to my daughter's kindergarten class to do a presentation for this month, because heck yeah. And I talked about what happens when you go to a dental office. Now, if your kid has behavioral issues in the dental office, or you as a parent are nervous about what it's going to entail, you can connect with a teledentist or a telehygienist, and we can talk to you step by step about what's going to happen. And so going into the dental visit, it's not as scary as your mind makes it to be. And we can talk about when you need to see a dentist, what's going to happen, next steps, et cetera, all through the comfort and security of a teledental visit. So love that. Parental guidance.
Oh my.
Should have been the complete slide. I still want parental guidance. Like, how do I get this kid to brush? No, I'm just kidding. We know the answer. You headlock. But teledentistry offers the opportunity for parents and guardians, again, to seek guidance from oral health specialists. So it's a little redundant here, obviously, because we're trying to drive this home. It's not going to be the kid that clicks through. It's going to be the parent. So common issues. Oh, sorry. Go ahead.
Like just very recently, a parent took a picture of a baby tooth being pushed out in the buccal and saying, oh my God, the permanent tooth is pushing the baby tooth out. Now that taking time off from work, taking the child out of school and going to an office or going to the emergency room would have been a real waste. It's supposed to do that. Yeah. It just looked funny to the parent, but when you get to talk to the right specialist, it takes parents off the ledge of saying, oh, okay, I feel better and not feel neglectful because my child looks really funny having this tooth sticking out of their gum up there. So it happens all the time. Eruption sequence and eruption, how many times have any of you that are dentists seen the tooth growing in behind the bottom tooth, and they're going to rush that child into the dentist or somewhere to have some specialist look at that, which is just, again, eruption sequence and et cetera. So those are real good things that a parent talking to the right specialist can feel better about what they should do and what, not feel guilty that they haven't done something they should have done.
Yep. And what did you say the percentage of visits in a dental office that could be done through teledentistry? About
25, and I'm not even sure pediatrics, the general dentist, 25% of the visits that go in and sit down in the chair of a dental office don't need to be in live in the chair, and that opens up chair time, that decreases staff demands, that decreases the dentist demand, because they can do a half hour's blocked off for almost every visit. They can do that with the patient in about 10 minutes, talking to them on video consultation. So huge time saver for parents saves gas. It's good for the environment.
green.
It's good for the environment, saves parents time, saves the dental office time and money, and can still keep the patient going forward with good oral health.
Love it, love it, love it. Oh yeah, we already talked about this. I mean, the childhood issues that waste chair time that you just mentioned, like thumb sucking or pacifier use. I mean, I do these consultations just in my kids' tumbling class. But if you have the opportunity to use teledentistry in your dental office, or if you're a parent and you need more guidance on thumb sucking or any my kid hates toothpaste.
That's my favorite.
Vita hated toothpaste
Yeah.
until we found the strawberry one that now we can't get enough of.
But again, I tell them when adult people say I don't like toothpaste, it's not the toothpaste that does the work. It's the bristles scrubbing. So, again, take parents off the wall, wet the toothbrush and get it in there and scrub those teeth. They won't get the fluoride, but if you're in a fluoridated water area, you're still going to be okay. But those bristles that scrub the plaque off are the important part, and toothpaste just adds to the better taste and a little bit of fluoride.
We're going to be put on so many blacklists after this. We're talking about Cuban communism. We're talking about how toothpaste is an important Procter & Gamble. That's the fun part of this. But again, connecting parents with oral health providers so that they can thus get guidance and help to make their kids healthier and smile. This is one of our biggest and strongest
Pushes.
boulder. Collaboration with primary care providers. Now, I believe it was Colorado that started the fluoride on the kids' teeth during their PCP visits. I'm not sure if they're still doing that, but hopefully they are.
Cavity free by 3.
Cavity free by 3. Love it. Yes. We would love for that to be a common use. I mean, I remember my first few visits with my pediatrician, they never asked where my kids go for dentists or any of that.
So the Academy of Family Practitioners and the Academy of Pediatrics both recommend oral health integration into the primary care offices. They have codes that they are approved to put on fluoride. The American Medical Association just approved in July codes for trained medical professionals, and it doesn't have to be the physician, it could be a tech, to be able to apply silver diamide fluoride if indicated. Again, you have a teledentist in the office, do a screening and say, here's where we're going to apply silver diamide fluoride, and with a trained professional. And if not, they can get training with us and through us to be able to stop the decay process with silver diamide fluoride in the medical office. Again, one of my favorite quotes. Most of this research was done before COVID. I'm sure there's going to be new ones out, but in 2019, 108 million people saw their physician in the United States and didn't see a dentist. Corollary, only 28 million patients saw a dentist and didn't see a physician. So in my book, that's 138 million people that need to see the right specialist for their care. But 108 million people that could have had a primary oral health contact in their primary care office. And sadly, the statistics on that, when interviewed, only 7% of people that have had primary care visits said they had any discussion or help with their oral health needs.
Yep.
So we have a big area with which to work with our fellow professionals to integrate oral health. And that's a key component for our partnership with the National Minority Health Association, is to get in areas where there is no dentist, to be able to get that healthcare professional to have the teledentist in their office and say, yes, that child would benefit from fluoride varnish, let's do that. Or, oh, we need to apply the silver diamide fluoride in several locations. And it's a billable procedure now. So there's no reason not to do that.
In fact, Elevate Oral Care has a specific kit for medical offices that includes everything from the gauze to the SDF. And they're creating them as packages now so that they can sell them to medical offices to help push this dental medical integration and SDF practices to help arrest cavities. So huge one. If you want to learn more, we have a fantastic SDF course that's coming out soon. It should be in the Tooth Apps upgrade day. If you haven't done upgrade day yet, we're wrapping up. So hurry up and get your webinars through there as well. They're free to watch. Oh, the places you'll go. I love that. We have
all right, Dr. Seuss.
Yeah, that's right. My son Oscar's bedroom is decorated with Dr. Seuss because, the places he's taking me, Looney Bin. No, I'm kidding. But so where can you practice pediatric teledentistry? And these are just a few of the examples, hence the large etc. at the bottom, because we're still rolling out new ideas and, waking up in the middle of the night, oh, we should do it here. So, from home, the most obvious, if you have an emergency or a general question and you just need to talk to somebody, you talk to a teledentist. School screenings we've talked about. I've done presentations in libraries, which I thought was super amazing. So as a virtual tooth fairy, which we'll talk about next, I got to speak to a library group of kids who were there for story time, and I talked about brushing habits, which was really fun. Speech therapy, for those thumb suckers, binky biters, and whispers. There's a way to conduct speech therapy through teledentistry so that they can actually have the proper way to pronunciate or enunciate words and be able to maintain that good structure in their mouth.
And I'm sure you all have parents that say it's just so cute, but it's not going to be cute when they're 12 or 15 or president of the United States.
Not president.
Not cute. So work with your parents, work with the child, get them to the right location and also poor speech affects oral facial development. Again, I'm speaking to the audience, but the tongue and oral habits are muscles, and muscles help form bone. Poor speech habits, affect oral facial development. So speech therapy is extremely important if the child looks like he needs help or she needs help.
Yeah. Doctor's offices, we just mentioned, the primary care provider, pediatricians love to hand out books at the end, and suckers, which is my favorite, but they could easily hand out a book about toothbrushing and dental practices as well to help encourage going cross professional education, if you will, and et cetera, et cetera. By this time next year, we'll be celebrating even more successes from the teledentists reaching out into the pediatric community. We did create the virtual tooth fairy. Love her, she's fantastic. But we were talking about Christmas and during COVID, how Zoom Santa was so popular. I mean, that industry blew up because obviously they couldn't get a hold of sit on Santa's lap in the mall. And we realized, Santa only comes one time a year. Easter Bunny only comes one time a year. The tooth fairy comes 20 times to kids' house, hopefully not more than 20.
Wisdom teeth.
Right. Well, but they need to have a way to connect to a tooth fairy, aka a dental hygienist, and talk about eruption sequences. It's a magical time. We're losing teeth. How do we keep them healthy and keep our permanent teeth healthy in the process? And for those who attended today or watching it, you get a free visit that you can either come through as an adult or share with a kid that you know. I'd love to see them and talk to them. It's always my favorite. One of my favorite kid tooth fairy ones. The kid was very mad at me because I didn't come to see her last night. I guess the parent had forgotten. And so my initial reaction was, well, was your room clean? And the parents in the back are going, no. So I said, well, obviously I can't come see you if your room is so dirty. I've probably fell over something and lost your money somewhere. So save the parents, and also help the kid clean their room as well as their teeth. So it's very fun.
One of the things I love about the tooth fairy for parents that have to travel, and I'm sorry, when you're not going to be home at the most critical time, the tooth fell out and you're on the phone, they say, Mom, Dad, my tooth fell out today.
Mm-hmm.
You can schedule a tooth fairy visit, and the tooth fairy can bring you in from wherever you are on a 3-party call with your child, even though you're not at home. So a lot of magic can happen with the right tools. And at a time when it is very important these things happen in their lives. It's a landmark for them. So you don't ever have to not be there now.
And one last but not least, my favorite application of the tooth fairies in pediatric hospitals. So these fantastic people that come dressed up as superheroes, even the actors that play those roles go and visit kids. Well, they're sitting in the bed, aspirating all these bacteria. Hand the kid a tablet, let them talk to a tooth fairy, let them learn how to keep their teeth healthy while they're undergoing whatever treatment that brought them to the hospital, but also give them a little bit of magic and happiness during the time that they are stuck in this unfortunate location. So that's a really great utilization of teledentistry and tooth fairy.
This is my favorite. So I started the teledentist in 2014, long time ago, and lots of milestones have happened along the way. Christmas of last year, 2022, not 23, the World Health Organization finally came out with an oral health mandate, mandating that global oral health status is poor, and they recommend that oral health be part of the universal health care coverage by 2030. Wow, that is huge. And that is not just third world, it is in the United States. Our oral health is abysmal for the development country we are in. But that means we have 6 years, guys. Only 6 years that hopefully between now is one of my agendas, that medical insurance is required to include dental insurance. You know, there's not going to be, if you think the teledentist is taking any patient away from anybody, we are only your best friends. We're trying to get people into the dental office that might not have gone. And I'm on the federal lobbying committee of CTEL, trying to lobby that these things that need to happen will be part of a, governmental mandate so that we can actually get that agenda and meet that agenda. And one of the main reasons people don't go is they don't have dental insurance and they're afraid how much it's going to cost. They don't ask how much it's going to cost. They live in fear rather than finding out. But that is statistically one of the reasons people don't go to the dentist. So won't it be wonderful when we have universal healthcare coverage for oral health by 2030? Yay.
And with the
I'm not at all excited about
Right.
that, folks.
with this tool, it can be implemented turnkey.
Yes, it could.
All right, so prevention is key. We know this. The lifetime cost of a tooth versus saving. I don't know what that meant.
Prevention.
Prevention.
Versus restorative.
Well,
Yep.
you already mentioned that it's 4 cents to the dollar,
Yep,
right?
yep.
So, and I was looking up nationally, I think the cost of a crown now is about 500-600, and implants like 2,000, which I thought would be more, but
It's not the crown on top costs more.
ooh, touche.
Yes.
Okay, that makes
Yes.
sense. But we've partnered with, and this is just 2 out of the many. If you haven't been to our marketplace, go to our website and click on marketplace, because there are some fantastic products out there. New Enamel is all about prevention. There is a self-assessment quiz that you and your kid can take, and it'll put you at what risk you are for cavities, and they come up with a customized package that they ship to your house of products that you use to prevent cavities and help reduce your risk. And it's customized just to you, which is fantastic, and highly recommend, obviously.
Let's not forget that we now know caries can remineralize, and now with all of the hydroxyapatite products that are out there and all the fluoride and all, they can take incipient decay and we can remineralize those areas if we can get the person to follow our protocol for remineralization. So we have lots of tactics we need to use to develop. We're not putting ourselves out of business. That's what they said a long time ago when the high-speed handpiece was invented. When dental insurance came along, so dentists are putting themselves out of business. We are actually being healthcare providers and helping our patients be healthier. And there'll always be the need for broken teeth, straightening teeth, and et cetera. So there's new skill development down the road. Yes, if we can ever impact to remineralize these caries on these small children before they become cavities. And there is a time, not just 3% of the population will grow up without a cavity, but we can make a huge number of the population not have any cavities in their entire lifetime.
Tooth Pillow is another cool organization we work with. It has I want to call it a at-home night guard for kids. My daughter Vita was in it, and it helped expand her palate while protecting her, because both my kids are lovely teeth grinders. And I just hate asking the PCP, oh, what do I do about my kids' teeth grinding? Oh, they'll grow out of it. You know what? In the meantime, in the 6+ years that you have to have these baby teeth, I'd like them not to get broken from this grinding. Plus the expansion that I've seen in her diastemas are beautiful, perfect, and ready to go for those permanent teeth. So I have literally saved myself thousands of dollars for phase 1, phase 2 of ortho. Plus I don't have to hear her grinding her teeth at night. There's lots of cases. In fact, please go check out their website about sleep apnea in children, night terrors, bedwetting, ADHD, all of that can be prevented with a good, nice sleep. And Tooth Pillow is what is used for pediatric patients.
And as anybody in the dental profession and the medical profession knows now, sleep has become the new drug of choice to make sure people get enough sleep
Mhm.
to be healthy. And the children have a lot of the same issues. So structurally, if dad snores, I mean, that happens definitely in her little one. He's shaped just like dad.
Mhm.
Structurally, his lower jaw is set back. The little guy, he's going to end up with the same kind of problems.
And
as
he's
dad
gonna end up
has.
with a tooth pillow,
Yes,
absolutely
he
not.
is. Mhm.
See, I've learned from
Mhm.
tooth pillow, I've learned from TeleDentistry, the products that I can use to make sure my kid doesn't have to snore like grandpa or dad does,
Mhm.
so.
So stick with us, not just on this subject, but we will be doing a lot more. But I'm so excited to have lots of innovators come to me with their new ideas because
Yeah.
they want to know how to get it out to the public. So stick with us. We have a lot more excitement coming.
And please do check out our marketplace and subscribe to our newsletter because you're gonna get lots of really cool startup and new products to sell and take care of your kids and your patients as well. So in summary, because I know we're past time, sorry about that. But by incorporating teledentistry into pediatric oral health care, we as providers, and this is not just medical, this is dental and medical, we can enhance access to dental services, improve patient outcomes, and promote a lifelong good oral habits with children, saving them time, money, and pain all along the way, and having them smile all along the way. So thank you all so much again. So excited to do these series. We'll have another webinar next month, but as you could tell, we are quite passionate about this one, and we look forward to hearing your responses. And I will send out to the attendees your little free virtual tooth fairy coupon, so you can share that with a kid, or again, come through as yourself. You'll see how much fun it is. And happy National Children's Dental Health Month. Yay.
Thank you.
Thank
Thank
you.
you all
Great
again.
job.
Yay.
You too.
We'll
Good
pause the
presentation.
recording and